Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Caregiver Stress Kills Hearts. And trust me, it's juicier than your cousin's peach cobbler. Here's something that'll knock your socks clean off. If you're caring for a loved one, your heart might actually be in more danger than theirs. Yep, entirely true. I can't make this stuff up. We're talking about a hidden cardiovascular crisis that's flying under the radar faster than a teenager avoiding chores. Let me hit you with some numbers that'll make your blood pressure monitor weep. Caregivers have a 40% higher risk of heart disease than people who aren't caregiving. 40%. That's like saying caregivers are playing cardiovascular Russian roulette while everyone else is playing checkers. And here's the kicker, most caregivers have no idea they're walking around with a ticking time bomb in their chest. So what's happening inside your body when you're constantly worried about mom's medications or dad's fall risk? Your stress hormones are throwing a party that nobody invited them to. Cortisol and adrenaline are flooding your system like uninvited relatives at Thanksgiving, and they're absolutely trashing your blood vessels. Add in the sleep deprivation, because who sleeps when you're listening for every sound from the next room, and the grab-and-go eating habits, and you've got yourself a perfect recipe for heart disease. But wait, there's more. And by more, I mean worse. Caregivers skip their own medical appointments 70% of the time. 70%? That's like ignoring the check engine light while your car is literally smoking. If you're putting off your checkups because you're too busy managing someone else's health, maybe I should see you in the clinic, because see, we need to talk. Then there's the physical strain. You're lifting, assisting, being a human crane for someone who needs help moving around. Your blood pressure is spiking like a teenager's attitude, and you're wondering why your back hurts and your heart feels funny. Add social isolation to this toxic cocktail, because when was the last time you went out with friends? And now we've got depression knocking on your door. And guess what depression loves to do? It loves to break hearts, literally. Oh, and let's not forget the financial stress. Medical bills are piling up like snow in Minnesota, and stress about money is like throwing gasoline on the cardiovascular fire. It's a perfect storm of risk factors, and your heart is caught right in the middle of it. Let me tell you about Sarah. She's 52, caring for her mother with dementia, and she thought she had everything under control. 6 months into caregiving, her blood pressure shot up to 160/100. She gained 30 pounds eating whatever was quick and easy, started having chest pain, but did she listen to her body? Of course not. She was too busy making sure mom took her pills and didn't wander off. It took an emergency room visit to discover she had early heart disease, all while she was laser-focused on her mother's care. Here's the thing that drives me crazier than a long line at the pharmacy. We're so busy taking care of everyone else that we forget we need maintenance too. You know that safety speech on airplanes about putting your oxygen mask on first before helping others? That's not just good advice for flying, that's life-saving advice for caregiving. So how do we break this dangerous cycle? First, schedule your medical checkups like they're non-negotiable appointments. I don't care if Uncle Bob needs his toenails clipped, your heart health comes first. Second, use respite care services. Even 2 hours a week can help your stress hormones chill out, and remember they're not supposed to be running a 24/7 panic party in your bloodstream. Third, join a caregiver support group. I know, who has time? But social connection is like vitamins for your heart, and sharing strategies with people who get it can literally save your life. Plus, you might learn some tricks that make caregiving easier. Here's your action plan for this week, and I want you to treat this like a prescription from your favorite cardiologist, because it is. Schedule one health appointment for yourself. I don't care if it's just a blood pressure check or a full physical, just get it on the calendar. Then arrange 2 hours of respite care. Call a family member, hire someone, trade with another caregiver, whatever it takes. Remember, taking care of your heart isn't selfish, it's strategic. You can't pour from an empty cup, and you definitely can't provide care with a broken heart. Your loved one needs you healthy and strong, not stressed and sick. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.